PBMs are pharmacy benefit managers, and they're basically a separate third-party group that works with drug manufacturers, insurance companies, and pharmacies to help figure out medication formularies and determine the final cost to someone filling their medication. Being aware of PBMs can help you understand the broader scope of medication coverage and what you can expect to pay when you go to the pharmacy. They can seem like sort of a far off, complicated thing to understand, but they have a lot to do with controlling your drug costs and what your insurance is going to charge for a specific medication. PBMs help develop medication formularies. They work to figure out where medications should fall as far as what tier of coverage, what copay, if they should and should not be covered by an insurance plan, and this is all based on different treatment guidelines, the cost of the medication, whether it's brand versus generic. There are a lot of things that come into play, and it's thousands, if not millions of medications we're talking about, so that's where they really are helpful. Individual insurance companies can't necessarily navigate all of that information on their own, so PBMs sort of aggregate it and make it easy to understand and accessible so insurance plans can access it and pass that along to their patients. PBMs were originally created to make the system more efficient and to make medications more affordable. Before they existed, a lot of insurers only covered a really small percentage of the available prescription medications. Once the PBMs came into play, they worked directly with the manufacturers to make sure that their medications were available to everyone within an insurance plan, so that by the time they took effect, a much larger percentage of medications were represented by the insurance companies and even covered at all. So their original intent was to open communication and pass savings along between the drug manufacturers, the insurance company, and then the people coming to the pharmacy. PBM restrictions can come into play when you get a rejection for a medication saying that it's not covered, or there are extra steps required in order for it to be covered. For example, you might need a prior authorization, which means your prescriber needs to fill out paperwork to explain why you need this specific medication. Another common override is something called step therapy, where your prescriber has to show that you've tried one or two different medications before they're going to cover a higher cost or a less preferred medication. If neither of these is an option, you can also file a general appeal to your insurance company, which then gets passed on to the PBM to see if there are any other ways you can get some sort of override from your insurance to cover the medication. If you need additional help, you can talk to your prescriber or your pharmacist about manufacturer copay cards, patient assistant programs, and even cash price discount cards that can help make the medication more accessible for you.